Thank you, Parthibai, for the kind introduction. I hope you all are enjoying the conference. It looks like it's a great success, and I'd like to congratulate you all for organizing this conference. And I'm very happy to be presenting Cure Companion to you and telehealth, which is some of you may already know about it. So I'd like to start with something that we all know, which is about healthcare today. In healthcare, there's a change happening. There's an evolution happening because of mass consumerization, mass availability of mobile devices and the internet has created a consumerization of healthcare. Not only healthcare, a lot of other industries as well. And in fact, today healthcare is ripe for disruption. Traditional ways of managing healthcare are falling short because of, there's so much data to manage, there's so many different things to be done, and technology is really the only solution to use. Patients today expect healthcare to be more accessible to them. They expect to be able to, use their mobile phones. Patients are always searching for symptoms online using their mobile phones. They expect to be able to communicate with their doctor, right? A lot of people use WhatsApp or email. Really, there's a systemic trend towards increasing this healthcare access. And this is happening around the world. Not only India, but the US and a lot of different places are changing. So you may ask, why telehealth? What is telehealth? Why should I be interested in knowing about it? Telehealth is really a way to break the physical barrier of healthcare. So right now, as a doctor or hospital, you usually only see patients from your own geographical area. Patients who live in the same town or same city are the only ones you can see. But if you use telehealth, you can break this physical barrier. You can expand your reach to patients outside your area. You can even, treat international patients. And this is very convenient for patients because they don't have to travel, they can see doctors from anywhere in the world. And they don't have to keep traveling, or the doctor doesn't have to keep traveling. So it's a convenience and flexible way of doing medicine. Now I'd like to say that telehealth or telemedicine does not replace the traditional way of providing healthcare. It really complements it. So it kind of fills in the gaps where there's opportunity for better communication and interaction between doctors and patients. We need to leverage technology to improve healthcare, and that's what telehealth can do for you. So Cure Companion is something that we created after observing all these things and seeing an opportunity. Basically, we've created a telehealth platform with integrated health records. So you can do online consultations with patients when physical examination is not required. We have apps for patients and doctors on iOS and Android. So you could use your iPad or your iPhone to do a consultation with your patient and get paid for it. So one thing I'd like to say is that, as I mentioned, some people may be using WhatsApp or email or SMS to talk to their patients or to share health records with other doctors, but the truth is that these are not secure ways of communicating. In fact, in the US, it is illegal to use WhatsApp or email to communicate patient information because it is not secure and it violates patient privacy. So keeping this in mind, we decided to design Cure Companion from the ground up with security in mind. We are HIPAA compliant, which means USA's Privacy Act is called HIPAA, and it has strict mandates for security and privacy, and we are compliant with that. So Cure Companion has a HIPAA compliant messaging platform as well as record storage and video communication as well. As I mentioned, telehealth is a way to break the physical barrier. And that's the key thing that to keep in mind. Cure Companion provides crystal clear video consultations. You know, all you need is a 3G internet connection or Wi-Fi, and wherever you are, you could be on vacation, and your patient hasn't, or the patient could be on vacation, and if they are having an emergency, they can just quickly call you and get your opinion on what they should do. Apart from security, another thing we prioritized was ease of use for doctors especially. We noticed that healthcare software is usually extremely cluttered. You know, and there's a reason for that. There's so many features. Healthcare is a complex thing, and any software that manages it has to have a lot of features. But if you're not careful when you're creating these softwares, they can become very cluttered and they can confuse users, and it makes it very hard for new users to start using these systems. So one thing we wanted to do was create a consumer-like application for doctors, something like Facebook or Twitter, something you don't have to be taught how to use, something you can learn on your own. You can just download the app, you just open it, and you know it's very obvious how to use the app. That was one of our main goals while creating these applications. Now, another interesting thing we've done is we've integrated some medical devices into our platform. So before I mention this, let me say a little bit about the patient app that we have. Cure Companion is a patient-centric approach to telehealth. So we noticed that usually any healthcare software is focused or geared towards the doctor. But what's really important is the patient. The patient is the one who has the illness, and you know, they are the ones who are coming to you for your help. So we decided to create a patient-centric platform, and patients can store their health records in the app. They can share them with doctors. They can find doctors. They can request video consultations, and finally pay their fee with a credit card. So one thing we've integrated into these apps is a bunch of medical devices. So we have this Bluetooth stethoscope, which communicates with Cure Companion, and you know, you can use this system to create like a remote OPD or remote outpatient department. So for example, a hospital where there are a lot of specialists, it may have a satellite branch where these specialists are not available, or rural areas, for example. So what you can do is you can create a remote OPD there, put these devices there. We have a Bluetooth stethoscope, a Bluetooth blood pressure monitor, as well as pulse oximeter and EKG as well. So basically the nurse or local technician at that remote OPD puts the stethoscope on the patient's heart, and the doctor in the hospital, the specialist in the hospital, can hear these heart and lung sounds in real time. And that's what telemedicine is. And again, this is on top of the video call that the doctor is doing with the patient. So as a specialist, you're talking to the patient, you're talking to the nurse or the family, and at the same time you're getting a complete picture of their condition using Bluetooth stethoscope and the blood pressure and all these devices. And once you have this clear picture, you can make a better educated guess, better diagnosis about what course of action needs to be taken. Whether the patient needs to come to the hospital to do a surgery, or whether they can, whether you need to prescribe them some medication. All of this can be done on Cure Companion. As I briefly mentioned before, international patients, nowadays actually, around the world, patients are willing to look around for high quality medical care at an affordable price. And as you all know, India is a great destination for getting high quality medical care. And in fact, a lot of patients travel long distances to come to get surgeries, to get procedures done. And Cure Companion is a great way to engage these patients early in their decision-making process. So when the patient is still thinking about where they should go, who they should talk to, whether they should get the procedure done, as a hospital or a doctor, you can reach out to this patient. This patient communicates with you. They upload all of their reports, their x-rays, MRIs, their blood reports. They put it all into Cure Companion, and then they contact you. So as a hospital or a doctor, you can review this patient's entire record. You can set up video appointments with the patient and gauge whether they need to travel to get this procedure. And in fact, this is also a great platform to provide second opinions as well. So a lot of times what happens is that patients, a doctor will tell the patient that, hey, you need to get this major surgery, like a knee replacement, for example. But the patient really wants to ensure that they really need the procedure. They want to get a second opinion. And they want to ask a doctor who's not as invested in the procedure whether they really need to do it. So all they have to do is just put their reports on here, and they can find a good doctor anywhere in the world, in India, in the UK, in the US, and they can just send them a request, pay with a credit card, and the doctor will do the video call with you. It's a very straightforward flow. So this is an excellent way to do an initial evaluation of a patient or a follow-up. So times when physical examination is not required is when telehealth is perfect. The patient doesn't have to inconvenience themselves. They don't have to take off from work or school. They could just go to work as usual, and when the appointment time is there, just take 10 minutes, 15 minutes a break, and talk to the doctor, and then go back to work. Very, very easy. So our doctors app is, as I mentioned, is geared for doctors. We've been working on it for over 2 years now, and it's a very simple app. You can create an account, fill out your profile, and you just enter information about yourself, facilities that you visit, your specialty, and how much you'll charge for a telehealth consultation. Once you do this, patients from the patient app can find you. They can search for doctors by specialty or by country, and they can review your profile. And our patient app is also very, very easy to use. You can, as I mentioned, you can upload your health reports, like x-rays, MRIs. You can take a picture with your phone, or you can upload a file from your computer. And anything you upload is automatically shared with any doctor who you consult, and only that doctor. So your information is secure, but it's automatically shared with any doctor who you choose to consult, which is very convenient. And as a patient, you can search by specialty or by country or by state. If you want a second opinion from a doctor in a reputed hospital, you can find them and send them a request and pay their fee with a credit card. Excuse me. So the devices I mentioned, there's just some information about them. We use all FDA-approved devices. FDA is the Food and Drug Administration of the United States. And they approve all medical devices and drugs and everything. So this is a Littmann stethoscope, which is Bluetooth. So these are all third-party devices, and we just integrate them into our platform. This is the oximeter that we use, and these are very popular devices. Millions of doctors use these around the world. This is a blood pressure monitor that we use. And we also have a cart which can be placed in a remote clinic or a nursing home, for example. And we actually have a robotic tablet device which the doctor can remotely control through their app. So let's say a nurse calls you on your phone on Cure Companion. You can tilt and rotate that the top part of the camera to see the patient, their family. So it's a hands-free system for a remote location. So I'd just like to show you some screens of how Cure Companion looks. This is the patient app. And patients can log in on curecompanion.com, or they can download the Android or iPhone app or iPad. So once a patient logs in, they can store all of their records on here: X-rays, MRIs, blood reports, and any reports that any doctor orders. Let's say a doctor says, doctor who you've consulted says on Cure Companion, they say, hey, you need to get a blood report done. This could be a doctor in another city who you're consulting. And once they do that report order also shows up here on the top. And then you can go to a diagnostic center or your local doctor to get that done. You can see the full X-ray and zoom in and rotate. Then you can, as a patient, I can store medications that I take, and any new prescriptions that any doctor makes will show up here. And I'll get a notification on my mobile device saying that you have a new prescription from this doctor. And then if I go to the doctors tab, I can see all the doctors who are signed up on Cure Companion. I can, as I mentioned, I can search by specialty or by country, and I can, or by name. And once I find a doctor I like, I can click on their name to see their profile, which they've assembled themselves. So I can see basic information about the doctor, which facilities they visit, their educational background, and their experience. And finally, how much they'll charge for a Cure Companion consultation. So once I know this is the doctor I want, I can click on the consult button up here, and it's going to bring up a screen where you can enter your symptoms and your severity, and just any message you want to say to the doctor. And in fact, you can also schedule a video appointment with that doctor by looking at their calendar. So in the doctor app, doctors can set a calendar with available times for them to see patients. Whoops. So once I enter my symptoms, I click next, and simple, very simple, I just enter my credit card information, and then I can pay. So once I confirm this purchase, the doctor gets a notification on their app and by email that they have a new request from this patient. And once they accept, the patient is charged the fee. So as you see, we've created a very simple system for patients and doctors to improve their communication and just complement the traditional form of healthcare. And I'd like to thank you all for your attention, and if you have any questions, please let me know.